Hi, I'm Matthew Herzberg, and this is the Myopia Mindset. This is your weekly dose of inspiration, education, and motivation on your path to success with myopia management. And I have on for this episode a very special guest. When I started this podcast, I said, I wanted to be focused on clinicians, but also academics, industry professionals. I want all perspectives. Myopia management the myopia epidemic is a problem that we all need to work together on. And my guest for this episode is none other than Dr. Monica Jong. She's authored and participated in numerous peer-reviewed articles on myopia. She's led the development of white papers and key initiatives to bring consensus to the field of myopia management. She speaks around the world on the subject. She's worked with the WHO. She's worked with the Brian Holden Vision Institute. And she's the former executive director of the International Myopia Institute. And she is the current global director of professional education myopia at Johnson & Johnson Vision. Monica Jong, welcome to the Myopia Mindset.
Hi, Matt. It's an absolute pleasure to be here, and thank you for this wonderful introduction. I'm really excited.
Awesome. I really wanted you to be like my first big name in the academic sphere for sure, because you have come from you started out as a clinician, and you have participated in so many great key moments in our industry. And then in your current role, you have taken on the huge responsibility of advocating, supporting, and developing clinicians and professionals doing myopia management around the world. So I want the audience to get to know you first. So let's start with your days as an optometrist in pursuit of your PhD, and let's talk about where your passion for myopia management came from.
Like everybody, I started off doing optometry because at the time, I finished high school in Australia and I wasn't too sure what I wanted to do, but I knew I wanted to be in healthcare. And at the time, I really didn't want to go to school for too long. And I just thought optometry is a great profession where you can help people. And at the time in Australia, we only had to go to school for a maximum of 5 years. And I had a really inspiring optometrist who was doing full scope optometry, prescribing ocular therapeutics. And my first interaction with optometry was because I developed myopia. So this was when I was 10 years old in Australia. And I had no idea that that first interaction, being diagnosed with myopia, would result in me following this path into myopia management all these years later. So I went to optometry school, and when I finished that, I was actually in practice, and I worked in an optometry business where I was actually looking after the optometry side and partnering with an optical dispenser who owned the optical side. So I was doing my PhD at the same time because I wanted to broaden my knowledge. I also wanted to teach in the university part-time as well as practice. So I thought, okay, I'm going to do my PhD. Now that optometry practice was very, very interesting because I was located in an area where you had people of low socioeconomic status. There were people who were Indigenous, and then there were people who were also drug users in that area. But that area was also becoming gentrified. So there were academics, and then there were some really wealthy people because they were converting all these warehouses into lofts. So it was a really interesting place to really practice because I was doing family eye care. And then I was also co-managing with the family doctor around the corner. And that was where I learned to really practice full scope optometry and refer and write reports to the family doctor, and also do collaborative care with the ophthalmologists in the area too. So we're surrounded by eye hospitals as well as a lot of private ophthalmologists. So it was a really great time to be an optometrist and really get interested in pediatric eye care. In that area, I didn't really see much myopia at all because of the demographics of that area. People were mainly hyperopes and presbyopes, and even the children that came in were hyperopic. But that doesn't mean that there was no myopia. I just happened to be practicing in that kind of area. Now, I didn't realize back then But back then I started doing professional education too, because there was no materials available to me to teach people how to do contact lens insertion and removal. There was no education materials for me to teach people how to manage their dry eye. So imagine this, I came out of optometry school, started practicing there, working with other ODs, and I had to also start creating my own patient education materials at the time. And that was a great experience because people would take those education materials. I'd laminate them. Back then, I owned a laminator. I laminated how to manage their dry eye. I laminated how to insert and remove the contact lenses, and I drew pictures of contact lenses and typed up the instructions. And those patients, the parents, and the adults who were wearing contact lenses, the kids, they would actually take those education materials and put them in their bathroom next to the sink when they were learning. And they found that those materials were so effective. And they would even come back in showing me the materials and saying, we are using this. Can I have another copy? Because it's starting to get worn out.
That's
So
amazing.
it was really, it's funny when I look back on this because sometimes these are small signs that show you've kind of walked into your calling in a way,
Right.
doing professional
Yes.
education, working with patients, because that's what it comes down to. And who knew back then, like that dry eye and especially contact lenses would be the bread and butter of optometrists. And today, it's really the path forward to really
Right.
establish yourself as a practitioner, especially with myopia management and of course dry eye treatment. So I
Yep.
finished my PhD at the same time as when I was in practice. So I was working part-time in a really high volume type practice, full scope. And I did finish my PhD. It took a little while. And then I did a postdoc. But it was really when I came back to Australia, I saw an ad for a research optometrist role. It just so happened that when I came back to Australia from my postdoc in Toronto, Australia was changing, the academic sector was going through changes, and there weren't any uh, assistant professor roles available. And so I answered an ad for a research optometrist at the Brian Holden Vision Institute. And funnily enough, when I turned up, I was actually interviewed by Professor Brian Holden himself. And normally he doesn't interview people
Mm-hmm.
personally, but I think it's just when the stars align. I think Brian Holden was seeing the potential of this new area they were working in. They had been working in myopia for quite a while already, but I think they reached a pivotal point where they had IP, they needed to partner with industry, and they needed someone who would come in, who would be able to work closely with Professor Brian and pull together the projects as well as, I guess, do the education side and work with the researchers and the scientists. Because my background is I'm an optometrist and I did research in, at the time, it was OCT and retinal structure and function. I knew how to speak to scientists,
Mm-hmm.
and that's why he hired me on the spot. It
Well, let me
was,
ask you about that because sorry to cut in there, but so I have found that unfortunately there is a large part of the optometry community in the United States that is not aware of who Brian Holden was and his impact on the industry. Maybe they do in a conceptual sense or on a on paper sense, but like when you tell me you interviewed with Brian Holden, I'm just like, boom, my head explodes. Right. So let's talk about who Brian Holden was and like what he meant to you and like because that's an amazing thing, right? To work with him. I had the opportunity to meet him one time. I heard him speak. I immediately fell in love with like his passion about it, his candor. He was making a comment about it was the hygienic care of ortho K lenses. And he made a joke about like when you smell someone farting, what that means. You know, the particles, the fecal particles landing on your mucous membrane. And he used that as an analogy for why we need to stop having our patients put their lenses in the bathroom. And I talked to him afterwards, but like you knew him, you were interviewed by him. So tell us, who was Brian Holden? What was your relationship like that? Because I think that's amazing.
yeah, like I never thought in my life I would be working with Professor Brian Holden because when we went to school, he was always in the textbooks as Holden et al. And it was always associated with the silicon hydrogel development. He came to fame because he had He was one of the first professors back in the 70s and 80s that actually started working with industry before anyone started working with industry, or that was the norm. And he had co-developed Sci-Hi, and then also a lot of optical designs in soft contact lenses, stabilizing toric designs. And he partnered with pretty much every single big contact lens company out there. And he was part of the group that worked out the level of decay needed and built that category of Sci-Hi. And when I turned up, I didn't realize that he was going to be the one to interview me. So I wasn't expecting that. But it was fate. That's all I can say, because if I hadn't met him, I probably would have gone back into optometry practice and not gone into research and had the career I've had so far, because I wasn't sure I was going to go into research at that point, because when I'd come back to Australia, the landscape had changed. There was no assistant professor roles, as I mentioned. But as soon as I walked into the room, there was this larger than life guy. He was larger than life. If you've ever met him in person, he's physically huge.
Yes.
He's 3 times bigger than me, at least. And he's probably at least 1 foot taller than me. But as soon as I walked in, I felt really at ease. He had that persona, the charisma, that when he focused his attention on you, you were
Right.
the center of his world or his focus. And he was fully listening to what you had to say, and he was really interested. But that interview really changed everything. I mean, he was talking to me about all the amazing things that he was leading Brian Holden Vision Institute through, that it wasn't just myopia, because at the time it was just like all this new technology accommodating gels, advocacy, vision centers, presbyopia, astigmatism, retinal cameras, lots of amazing things. And we just really hit it off because we were both, I think because we both came from the same school originally, and then we left that school in that city and did our own thing. And he kind of saw a kindred spirit in me. And his personality, like you mentioned, the way he talks, he's rough around the edges.
Right. Yes.
But that actually hides his heart of gold. He's that type of person, incredibly kind, but interested, curious. And people use the word visionary, but in truth, he was visionary because he was seeing where the profession and the next big thing was over 20 years ago. And he was at that point when I met him that he needed someone to work with him really closely. He had a great team, but he needed an addition, some new blood. And I think we became friends at the same time as being bosses, because I really understood him. He worked so hard. He flew everywhere constantly. He was always on the go. And I think that kind of gave me the training of what it takes to work in industry.
Right.
Even though he was an academic running a nonprofit research institute, his work ethic, he just never stopped.
Right.
And anyone working closely with him had to be able to keep up somewhat with him. And I was probably one of the people who could just keep up with where he was going with all his different projects at the time, and still being able to piece it all together and still find the strategic direction of how to get there. And that was one of the skills that I learned from the ground up, because you can imagine my only experience until I started working at the Brian Holden Vision Institute was doing my PhD, learning how to do research and submit ethics, and then working in practice, seeing patients, very different skill sets.
Right.
But I think that training, coupled with my personality, it was very complementary to him. And then I also understood and had that flexible nature to be able to cope with things and be able to work across many different projects and have that energy to keep going. And being a young person at that time, younger, I should say, I was still quite ambitious and I really wanted to gain all that experience. And he didn't really give me too much details about what he wanted me to work with him in at that interview. We didn't even discuss how much I was going to get paid. But he excited me with his energy, and I was excited about the potential in the future. And I honestly hadn't heard about myopia control at the time, because even though we talked about it in school, at the time, all everyone knew was that you had put lenses in front of animal models' eyes, minus lenses and plus lenses, and these could make the eye grow to different lengths based on the lens. So here I was, hearing all this new amazing technology and having all these terms thrown at me like spherical aberration. Imagine someone throwing those terms at you during your
Yes.
interview: spherical aberration, higher order aberration. And all I was interviewing for was a research optometrist role.
Yeah.
And I didn't ask too many questions. I was just like, yeah, this is so exciting. I'm really wanting to do this. And then he's like, when can you start? When can you move up to Sydney? So at the time
Yeah.
I was living in Melbourne, which is like 12-hour drive away or a 1.5-hour flight. And he's just like, yep, let's get you started. When can
Yeah,
you
you
start?
clearly impressed him, because he was, my understanding, I read your interview in Myopia Profile, and he was like, you have to come work with me. You know, is that true? Like he was like very excited about you and what you brought to the table. And I think that speaks a lot to who you are, because I've had very limited interaction with him, and he was very rough around the edges. He did have that heart of gold. You could tell that, but he was also not an easy person to impress, quite frankly. Like, we're talking about like the head figure in our industry, so like, let's talk about like where you went with that and how it guided your career, because you would go on to become the executive director of the International Myopia Institute, and then it would lead you to your current role with Johnson and Johnson. So let's talk about like how you developed after that point.
Yeah, like for some reason, my CV fell across his desk.
Hmm.
That's what I'm really grateful for, because usually CVs don't get to him because someone else hires in BHP. So when I did my postdoc after my PhD, I went to University of Toronto, and in partnership with the University of Waterloo, I worked with Professors Christopher Hudson and Professors John Flanagan. So I did a good postdoc, but then I came back to Australia. And I think the fact that I was able to pack my bags in Australia and just
Hmm.
go to another country all by myself and do a postdoc, that already shows that you're that type of person who's willing to take a risk, because, life
Right.
can be pretty easy and good in Australia, I have to admit. And so he saw that. And then when I came to BHVI, he just threw me in the deep end, because that was him kind of testing to see if you have the capacity to learn fast, because there's no training track for what I was going to be doing or working in when I work with Brian Holden. One moment I was sitting in the clinic doing clinical research trials where I'm seeing patients and collecting data. And then the next moment, he was like, we're going to be going to China and meet with collaborators there. And we're going to leave next week. We're going to go to China, 2 cities, and then we're going to go fly across to the US to American Academy, and we're going to have some meetings. And then in a few weeks, you're going to do your first talk to 400 people on a stage in America.
Wow.
And so he was testing to see if you could step up and
Right.
elevate and get to that next level. And he didn't give me much time because he was working at a fast pace. So imagine I started, and then 2 weeks later, I was traveling. And then by the end of the month, I was doing a big talk, because he needed more people on the team to help, because there were um, so many projects going on in different parts of the world. And when you worked with Professor Holden, you either sank or you swum.
Yes.
And if
Yes.
you sank, you'd probably be working in another team, staying on site. You wouldn't be able to work with him at that pace. And so it was a very interesting time, I have to say. I didn't think too much about the bigger picture of why I'm doing this, or where's this going to lead me, or is there a future. I for some reason just trusted him, because he gave off that trust, and
Yeah.
you could have faith in him to follow. And he allowed me to lean in and bring my own viewpoints, my own skills, and make that job mine. Because the way he managed was that he said, this is what we're going to do. high level and then let you work out your way to deliver it and do it. And so it started off, just working on his things, working on papers, working with other teams from different areas. I could be working with people in clinical trials, and I'll work with someone in the public health, in the vision centers, and then working with some of the schools of optometry where they were being established in the developing countries. And then I'd be working with engineers and even talking to the patents attorneys. So I got exposure to so many great minds, so many talented people. So I was able to just learn a lot just from talking to people from
Right.
osmosis. And once we had done significant number of myopia trials and things like that, it just so happened that there were opportunities where it got to the point where it's time now to start talking to people outside of just our institute about myopia. It got to the point where you needed to educate practitioners about myopia management because they'd never heard of this. This we're talking about over 10 years ago. To
Yeah.
them, it was voodoo. You would know
Right.
that because you've been in
Yes.
AOMC and doing ortho-K, being involved in ortho-K for 20 years. People
Right.
still thought it was voodoo at the time. And so it was about building the train, but firstly building each track at a time. That's what we were
Yes.
doing and planting the very earliest seeds. So we started talking to practitioners in US at key meetings, as well as China, as well as developing countries, because in developing countries, they do struggle to even correct myopia. So we had to uh, educate based on where we were. And then at the same time, the medical community didn't consider myopia an ocular disease. They didn't even consider it anything on the public health agenda because they just thought, hey, it's myopia, just give people a pair of glasses. What's the issue? And so I also started to work with Professor Holden, Professor Serge Reznikov, and Professor Koven Naidu and Professor Earl Smith at the time to start talking to leaders in ophthalmology, the leaders in science. So talking to WHO, International Agency for Prevention of Blindness, and even way back then, 10 years ago, we had started talking to BCLA, American Academy of Optometry, the GSLS. And that's how we start building the awareness about myopia very, very slowly, being strategic and talking to the peak health bodies and the professional associations. And it was a real landmark when WHO recognized myopia as a ocular condition. So at the time we had the first WHO meeting on myopia in Sydney. And that was when we had 32 representatives for eye health across every WHO region convene in Sydney. We went through all the evidence about myopia, the treatments, and then came up with the first set of consensus definitions that would help lay the foundations. And whenever you have these big kind of meetings, there's a risk that after the meeting, everything just kind of disappears,
Yes.
right? And that's why after the meeting, we formed a working group, which eventually became the International Myopia Institute. What is really interesting is when we first formed the International Myopia Institute, there were a lot of people who were out there saying, people have tried this before. There's no way you're going to be able to get everyone together. We don't even understand why there's a need for that. So I'm so used to having to push a boulder up a hill and work against the odds. People saying, no, you can't do this, you can't do this. But for some reason, I when I believe in something and I read the winds of change and I know that it can happen, I keep going. So I
Right.
think that's the type of personality I am. I'm able to see if something is real and if something can really happen. And then I just keep going forward no matter what. There were
Yes.
there were times where I wasn't even sure if the International Mope Institute would be funded. Um, I wasn't even sure if the first set of white papers would really get off the ground because if you can imagine, it's relying on everyone working together, contributing. Everyone has different timelines. Everyone has different priorities. Everyone has different viewpoints. And we know that scientists and key clinical researchers, ophthalmologists, optometrists, they all have their viewpoints and getting everyone on board moving in the same direction, saying the same thing, that was an incredible feat. But I have to say, being able to pull together the right advisory board at the time, the key people who really cemented what the International Myopia Institute stood for. It's about collegiality. It's about myopia as a disease. It's about advocacy and awareness and doing good things. I think it really demonstrates when we all collectively move together, we can make things happen. And because of the IMI being established, it really meant that other associations took notice. And you have ophthalmology today, the WSPOS, the World Society of Pediatric Ophthalmology and Strabismus, the BCLA, the World Council of Optometry, even American Academy of Ophthalmology, all recognizing myopia management as a standard of care in some shape or form. And that to me is really, really exciting.
Yeah. We've really come a really long way in relatively short amount of time. When you and I have the benefit of being able to, because we were there essentially, each in our different way, of course. A lot of what you said resonates with me because I remember a lot of those moments. People need to understand that our industry was these different groups, these different personalities, these different individuals. And I've always said that myopia management is a people industry because it's really these people that came together from all different perspectives, walks of life, different organizations, different industry, whatever the case may be. I mean, there was a divide between clinicians and academia as well, because clinicians were saying like, we are doing this in our practice. And, the academic side was saying like, we need the science behind it to prove it, that, and there was this argument going on about what was most important. You mentioned that you were planting seeds, and I'd like to see if some of those seeds have come to fruition, because we're in a much different place right now. Like, I remember a time when there was the chaos. I remember a time when the argument was, well, we don't have the studies yet that prove what these orthokeratologists are doing every day in their practice. There was a lot of resistance. So have those seeds come to fruition, in your opinion? Like, how far have we come since then?
When I look at when I started, even I didn't know anything about myopia control because it just wasn't talked about at all, right? There was nothing taught in the schools about it beyond just the minus and plus lenses used to control eye growth in animals at the time. And then it was only a very short time when I joined BHVI that they actually had demonstrated success in their clinical trials and efficacy with soft contact lenses of various different designs, as well as myopia control spectacles and also eye drops. So that was already a game changer. I was a non-believer, and then I became a believer because I saw the data. Now, orthokeratologists are amazing people because they were already seeing the results way back, and they knew it was true, but everyone thought that they were crazy people, that they were the cowboys. Now, clinicians were seeing that these kids or adults wearing myopia, well, wearing the ortho-K lenses weren't progressing. And once they saw that was the case with 20 or 30 of their patients over a decade, they knew there was something to it. And they really believed in it. But with any type of evidence-based medicine, to make it a standard of care, to be accepted by the rest of the profession, there has to be science behind it. And that's why it's really important that scientists are talking to clinicians. I talk to clinicians all the time, even in my work, because I know that clinicians are seeing things first. And when they see things first, we have to think, is it real or not? And we have to take what clinicians are doing and then test it and validate it. And this helps everybody because this helps elevate our profession in the eyes of the public, as well as with our medical colleagues by practicing evidence-based practice. It really gives patients faith in what we do. And I'm really proud to say that today there are so many studies on ortho-K, like thousands of children have had clinical trials of ortho-K done. that has demonstrated that ortho-K is one of the most efficacious myopia management options. And there's studies behind so many daily disposable soft contact lens treatments as well. And now there's also the new generation of myopia control specs. So I think those seeds have been planted. The discussions with clinicians have led to the trials and has led to the innovation in the development of treatments. And this has become full circle because those treatments then become approved by regulatory bodies as well, some of them. And then those treatments are available to patients. And once again, the practitioner is at the center of it all. The practitioner is the one who sees the patients, educates the parents and the patients, monitors the patients, and is the person who's managing that child from childhood all the way to adulthood, becomes part of the family. I've seen many cases where the patient's grown up and they've gone back to the optometrist at graduation and shared in life's joys. And all because the optometrist has managed their myopia, has corrected their vision. You know, those things, those moments are why we are optometrists. And that's still the reason why I do what I do. Like, it's just, it's amazing what we can do as a profession.
Yes. Yeah, definitely. And that's what this podcast is all about. Like, I want to share how awesome myopia management is. Let's get as many ECPs doing it as we possibly can. But I feel like we've run into a new problem. This is something that I saw when I was still with the AAOMC. I definitely saw it during my time as a clinical sales consultant with Johnson & Johnson, is that even though we have the research, you know, I remember days where ODs were saying, when you can prove it scientifically, then I'll come on board. And now we can. We have more studies, we have great information, we have everything we need. And yet this is still a huge stumbling block, in my opinion, in my anecdotal experience. Why are so many, do you agree with this? And if so, why is this such a problem? Because a big part of your role at J&J is supporting, advocating, and developing practitioners. Why are ODs, why are eye care ECPs struggling with how to transmit all of this great science into their clinical practice?
That's a really good question. And when we think about everything that we're hearing about myopia, all the studies that keep coming out, it is easy to think it's so complicated because every week we're hearing something new. Then is it this concentration of low-dose atropine? Then is it this concentration of low-dose atropine? And there's so many different types of soft multifocal type contact lenses or myopia control contact lenses becoming available outside of the US. And there's also myopia control spectacles that are becoming available outside of the US. And people are confused. They think, but then which is the best treatment? Sometimes I feel we should step back and really just keep it very, very simple. And that's what I've been trying to do in my work as professional education lead in myopia at J&J globally. I mean, it is unfortunate that the US doesn't have like the full range of treatments that, you know, your neighbors in Canada have.
Right.
But things are changing. And when we look at what's happening in Canada and other parts of the world where they have the full range of treatments, that has led to myopia management being adopted much more easily because the conversation becomes so much easier about myopia management. Now, the key barrier that practitioners tell me is that they don't have the time to talk about myopia and educate their patients. And then another key barrier is that when it comes to a contact lens, they find the chair time is an issue, and they also don't have time to train their staff to talk about myopia and then do all the I&Rs and everything that's needed to manage myopia. But this is all a misperception because firstly, the communication can be pretty easy these days if we're talking.
All right, well, that's it for this regular version of the episode, but the discussion doesn't stop here. It actually continues in an extended version of this episode, which is available to our Substack supporters. You can, if you're interested in getting the rest of the episode, consider becoming a paid supporter of the Myopia Mindset. In addition to an extended version of this episode and every other episode that we do, you'll also get access to exclusive monthly bonus episodes of the Myopia Mindset. And I know you're interested. You've made it this far. And for the cost is $12 a month, which is basically the cost of a cup of coffee each and every week. And that's how I like to put it. Listen, if you would buy me a cup of coffee each and every week to nerd out about myopia, to bring on amazing guests, to spread the word about how awesome myopia management is and how more ECPs should be engaged in this specialty, then please consider becoming a paid supporter of the Myopia Mindset. You can do so on our Substack. myopiamindset.substack.com is how you do that. Thank you so much for your consideration. I'll see you at the next one.